Am I audible? Good evening. If I'm audible, can I see a thumbs up on the live chat, please? Hi, Dokat. If I'm audible, can I see a thumbs up? Okay. So, good evening, Anil Kumar. So, if you're joining the session for the first time, this is Dr. Shanmugapriya. Thank you. Thanks, all of you. So, this is Dr. Shanmugapriya. I'm professor and head of the Department of Biochemistry at Government Thoothukudi Medical College. And I'm your Unacademy educator for Biochemistry. And today's session is part 2 of High Yield MCQs Marathon for FMGE aspirants. In this session, I will be discussing few MCQs related to amino acid and protein metabolism. Okay, because in the last session, I've tried touching most of the high yield topics of carbohydrate metabolism and lipid metabolism. Today, we'll try to discuss about amino acid and protein metabolism and chemistry. Okay, so before we start the session, let me tell you few facts about Unacademy's plans. And if you're an FMG aspirant who's trying to ace FMG December 2022 exam, there is a last mile revision batch. This is a well structured batch with all 19 subjects covered in 3 months. It will be a live interactive session with top educators, but as always, even if you miss the live session, you also have a recorded session that is available later on. Good evening, Patel. And PDF notes will be available. You also have an access to the question bank 2.0, which has got all case based MCQs, and it has just started on 16th September. And about question bank 2.0, as I told you, most of the questions, is my voice low? Am I audible? Am I audible and visible? Can you hear me now? Yeah, thanks. Yeah, I will do Vijay Singh. I will continue doing this until you write your exam. There will be a series of lectures for FMG aspirants on YouTube. Don't worry. Okay. Yes. So this has got many case-based MCQs, and for every question, a detailed explanation is also provided. So this will help you in conceptual learning of all topics. And NEET PG subscription plan. So this is a slide which tells you about the current NEET PG subscription plan prices. If you want plus subscription, good evening Ashish Patel. If you want plus subscription, the minimum that you can opt for is 6 months, and that would cost you 17,213. Iconic subscription, which is nothing but an access to both Unacademy and Preplada platform. Minimum duration would be 6 months. That would cost you 40,500. And we also have light subscription plan, which gives you an access to all tests and discussion sessions. Again, minimum duration will be 6 months, which is costing you 5,832. And if there is any first MBBS student who's looking for MBBS Prof 1 subscription, minimum is 3 months. That would cost you 4,950. So that's all about Unacademy's plans. Let's start discussing these MCQs now. And this is the first question for you. Hi, Captain Jack Sparrow. So this is the first question. A 31-year-old male presents with stroke. His homocysteine and methionine levels are high. Cysteine level is low. The probable diagnosis is type 1 homocystinuria, type 2 homocystinuria, cystinuria and cystinosis. What do you think is the right answer? Hi P. Yeah, what do you think is the right answer? They have clearly stated that the homocysteine level is high and methionine level is also elevated. Cysteine level is low, and there is early myocardial infarction or early onset thrombosis. Okay, so accelerated thrombosis and accelerated atherosclerosis. Very good. All of you are right. The answer is type 1 homocystinuria. So whenever you see a patient presenting with accelerated atherosclerosis or accelerated thrombosis, good evening Naresh Kumar Jain. Yes, whenever you see a patient with accelerated atherosclerosis or accelerated thrombosis, always suspect homocystinuria, because homocysteine thiolates LDL particles. It modifies LDL particles, and such modified LDL particles are more atherogenic. Okay, and that is why young patient 25-hour session lipid metabolism, I made it easy. Thank you, P. Okay, so it is going to be homocystinuria for that reason. But is it type 1 homocystinuria or is it type 2 homocystinuria? How do you find it out? And for understanding that, you will have to know about homocysteine metabolism. So I will give you just an outline that will help you in identifying whether it is type 1 or type 2. And for understanding this, you will have to know that homocysteine is a sulfur containing amino acid. So this homocysteine can have two fates. One is it becomes one sulfur containing amino acid, which is cysteine, or it becomes another sulfur containing amino acid, which is methionine. So that reminds me that I should tell you one basic fact about amino acids. There are two sulfur containing amino acids. One is cysteine, the other one is methionine. So whenever homocysteine gets metabolized, it should be either converted to cysteine or it should be converted to methionine. The major fate of homocysteine is that it gets converted to cysteine. How do we convert homocysteine to cysteine? Homocysteine reacts with serine. Yeah, homocysteine reacts with serine. The enzyme is, please listen to this discussion because it's a favorite topic of FMG. They keep asking you about homocystinuria. So homocysteine reacts with serine in the presence of cystathionin beta synthase. Yeah, the enzyme is cystathionin beta synthase, and this is B6 dependent, or it is dependent on pyridoxal phosphate. What does it form? It forms cystathionin. This cystathionin then gets converted to cysteine. Yeah, this is not NEET PG session. This is for FMG aspirants, but NEET PG and FMG, there is not much of a difference in what you are supposed to know. Yeah, these days FMG question papers also have case-based MCQs. Even in FMG there is image-based questions. So there is not much of a difference between how an FMG aspirant should learn and how a NEET PG aspirant should learn. Okay. So major fate of homocysteine is that it gets converted to cysteine in the presence of serine, and the enzyme is cystathionin beta synthase, which is B6 dependent. And what is the minor fate of homocysteine? Minor fate is that homocysteine gets converted to methionine. And the enzyme here is methionine synthase. It's a logical name, right? The enzyme is methionine synthase, and this is B12 dependent. Good evening, Angel. Yeah, this is B12 dependent. Now, what are the causes of homocystinuria? Logically, homocystinuria will be caused by either a defect of the major fate or a defect of the minor fate. Isn't that logical? Yeah, homocysteine levels will be elevated whenever there is a defect of either the major root or the minor root. And if it's a defect of the major fate of homocysteine, then that causes type 1 homocystinuria. Is that clear? So what is the cause of type 1 homocystinuria? It is caused by the defect of cystathionin beta synthase. And if it's caused by a defect of cystathionin beta synthase, can you tell me what will happen to cysteine levels? Yeah, the block is here. So what will happen to cysteine level? Cysteine level will be low. And the accumulated homocysteine, yeah, I will share it. I will share it, I'll share the annotated PDF on the Telegram group. Yeah, good. So when the homocysteine level is elevated, it gets converted to methionine. So in type 1 homocystinuria, there is low cysteine and high methionine. Is that clear? In type 1 homocystinuria, there is low cysteine and high methionine. So what is type 2 homocystinuria? Type 2 homocystinuria is caused by the defect of methionine synthase. And if it's caused by a defect of methionine synthase, the accumulated homocysteine will get converted to cysteine. So in this case, cysteine level will be high and methionine level is low. Is that clear? In this case, cysteine level is high and methionine level is low. So all of you repeat it along with me from wherever you are. In B6 deficiency also methionine level will be high. Yes. In B, that's what I'm going to tell you now, P. Listen to this for some time. So what did I tell you? There are two types of homocystinuria, type 1 homocystinuria and type 2 homocystinuria. Type 1 homocystinuria is the defect of the major fate. What is a major fate? When cystathionin beta synthase is defective, it is type 1 homocystinuria. In this case, cysteine level will be low and methionine level will be high. What is type 2 homocystinuria? It is because of methionine synthase defect, and when methionine synthase is defective, there is low methionine and high cysteine. So why should you find out whether it is type 1 or type 2? Can anybody tell me? Why should you find out whether it is type 1 or type 2? Because if it is type 1, it responds to B6 administration. Yes or no? If it is type 1 caused by the defect of cystathionin beta synthase, it responds to B6 administration. Whereas if it is type 2, that will respond to B12 administration. Got it? So now I'm going to fill up this tabular column. Yeah, can we try doing that? Yeah, when we fill up this tabular column, you'll be able to understand about types of homocystinuria clearly. So what is the first differentiating feature between type 1 homocystinuria and type 2 homocystinuria? The first feature is which enzyme defect. So type 1 homocystinuria is caused by the defect of which enzyme? It is caused by the defect of cystathionin beta synthase. Can you all answer this along with me in the live chat, please? Yeah. So type 1 homocystinuria is caused by the defect of cystathionin beta synthase. Whereas type 2 homocystinuria is caused by the defect of methionine synthase. That's the first difference. Second difference, metabolite concentration. Yeah, in metabolite concentration in type 1 homocystinuria, when cystathionin beta synthase is defective, what will you observe? There is low cysteine and high methionine. Whereas in type 2 homocystinuria, there is low methionine and high cysteine. Got it? Now the last difference is response to which vitamin administration. Type 1 homocystinuria responds to B6 administration. Type 2 homocystinuria responds to B12 administration. Is that clear? Yeah, so these are the differences between type 1 homocystinuria and type 2 homocystinuria. Okay. Now can you tell me the answer for this question? They have told you that it's a 31-year-old male presenting with stroke. So it is accelerated atherosclerosis, accelerated thrombosis. And that is why they've estimated homocysteine level, which is elevated. So you know it is homocystinuria. Along with high homocysteine, there is also high methionine. So tell me, what is the probable diagnosis when homocysteine and methionine levels are both elevated? It is type 1 homocystinuria. It responds to which vitamin administration, all of you? Type 1 homocystinuria responds to B6 administration. Okay. So this is the next question for today. A 9-year-old child presents with short stature, polyuria, polydipsia and photophobia. On slit lamp examination, the cornea shows characteristic crystals in the eye. The probable diagnosis is, what will be your answer? Can we start excluding choices one by one? Do you think it is homocystinuria? Just now I told you in detail about homocystinuria. Had it been homocystinuria, it would have presented only as accelerated atherosclerosis and as accelerated thrombosis. You are not going to find polyuria, polydipsia, photophobia. You will not find characteristic cysteine crystals in the eye. Okay, so we have straight away excluded what? Choice C is excluded. And there is nothing called a cystathionuria. So you are left with only two conditions. What are the two conditions? Cystinuria and cystinosis. Can I give you a shortcut? Yeah, the shortcut is cystinuria. The name tells you that something is happening in urine. What happens in urine? In this condition, cystine level in the urine will be elevated, and the cystine is insoluble in urine, so it presents as renal stones. Do you understand this? It presents as renal stones. So cystinuria, the name is a clue. It means high cystine is found in urine and it presents as renal stones. They will present with recurrent obstructive uropathy. And cystine and 6 sound similar. Yes or no? Tell me quickly. Cis and 6 sound similar, right? And cystine crystals are hexagonal crystals. On microscopic examination, what will you find? You will find hexagonal crystals. So is this cystinuria? Do you see anything related to renal stones? No. Okay. So this is not cystinuria. So what are you left with? You are only left with cystinosis. So now I am going to tell you about cystinosis. So cystinosis is a lysosomal storage disorder. It has got nothing to do with cystinuria. Cystinosis is a totally different entity. It's a lysosomal storage disorder, wherein there is a defective efflux of cystine from lysosomes. So can you tell me where are proteins degraded? Where are proteins degraded? All proteins get degraded in the lysosomes. So in lysosomes, after proteins get broken down, they give rise to individual amino acids. After which these amino acids, you have seen this case in OPD, in nephro posting. Very good, Dr. Saad. That is, had you seen it as, okay, very good. Cystinosis case he has seen. You are very lucky. Okay, so it is a lysosomal storage disorder. So usually in lysosomes, proteins undergo breakdown. When proteins undergo breakdown, they give rise to individual amino acids. Those amino acids are supposed to come out of lysosomes and they should get into mitochondria. Why should they get into mitochondria? Within mitochondria, these amino acids undergo breakdown. This is the normal routine. Now, what is cystinosis due to? Cystinosis is because of defective efflux of cysteine from the lysosomes. Do you understand this? Cystinosis is because of defective efflux of cysteine from lysosomes. So, cysteine accumulates within lysosomes. On chronic accumulation of cysteine within lysosomes, lysosomes undergo degranulation. So, lysosomes release acidic pH and that causes local tissue damage. Cystinosis presents with what? Local tissue damage. And when local tissue damage happens in proximal convoluted tubule, PCT is supposed to reabsorb 60 to 70% of all the solutes. So when PCT undergoes damage because of cystinosis, no solute will be reabsorbed. So what will it present as? It will cause glycosuria, aminoaciduria, phosphaturia, bicarbonaturia, polyuria, polydipsia. Because only when solutes get reabsorbed, along with that water also gets reabsorbed. In this case, because no solute gets reabsorbed, water is also not reabsorbed. So what will it present as? It will present as polyuria and polydipsia. So all of you tell me, what will be the presenting feature of cystinosis? Cystinosis will not present as renal stone. It will present as polyuria, polydipsia, short stature. Why short stature? Because PCT is supposed to reabsorb phosphate. When PCT fails, all phosphate gets lost, and phosphate is a major mineral of the bone. So when bone undergoes demineralization, that causes short stature. Okay, and this local tissue damage also happens in iris. Can you tell me what is expected when iris undergoes depigmentation? Do you all know that iris is the diaphragm of your eye? Tell me yes or no. Iris is the diaphragm of your eye because iris is pigmented. It does not allow light to pass through. Now in cystinosis, when iris is damaged, iris undergoes depigmentation. So it becomes transparent. What will happen when iris becomes transparent? All light will enter into the eye. So the child will complain of photophobia. Do you understand this? A child will complain of photophobia. So whenever you see a combination, what is the combination here? The combination is polyuria, polydipsia, short stature. If a small child comes to you with polyuria, polydipsia, short stature, and if the child also complains of photophobia, do a slit lamp examination. Do you understand this? Do a slit lamp examination that will show you characteristic cystine crystals in the eye. It will look like a shimmering crystal, yeah, glittery, shimmery crystals. So on slit lamp examination, if you find characteristic shimmery, glittering crystals in the cornea, then that is cystinosis. Are you clear? So will you ever get confused between cystinuria and cystinosis? Both are totally different entities. Cystinuria means renal stones. Do you understand this? Cystinuria means renal stones. Cystinosis is a lysosomal storage disorder. which causes proximal convoluted tubular damage. So it presents with polyuria, polydipsia, short stature. Iris damage causes photophobia. On slit lamp examination, you will see characteristic shimmery crystals in the eye. Okay. So that's about this question. Now this is the next question. A 20-year-old boy presents with severe mental retardation, mousy odor and body fluids, hypopigmentation. Patient has frequent episodes of seizures and aggressive behavior. What is your diagnosis? Can anybody tell me the right answer? Good, Dokat. Very good. So Dokat has answered it as untreated phenylketonuria. Do you all agree with it? Very good, Dr. Yogesh, Rubina, Suraj, Aishwarya, Rubina. Excellent. So what is the right answer? The right answer here is phenylketonuria. So why am I saying it is phenylketonuria? The clue that is given to you here is mousy odor. Yeah, so whenever you see the term mousy odor, your answer should be phenylketonuria. So how can we exclude other choices? Can it be maple syrup urine disease? As the name indicates, maple syrup urine disease will present with burnt sugar odor of the urine. Do you understand this? Maple syrup urine disease will present as burnt sugar odor of the urine. Okay, so this is not maple syrup urine disease. Can it be tyrosinemia? Tyrosinemia will present as what? It will present with cabbage odor of the urine. Yeah, tyrosinemia will present as cabbage odor of the urine. Albinism is not going to present with any characteristic odor. Albinism is just hypopigmentation, no mental retardation, no mousy odor. Okay, so this is how you have to exclude choices. Okay, so the answer here is untreated phenylketonuria. But I want you all to know about all urine odors and corresponding diagnosis. Yeah, so urine odor can be like a characteristic phrase that is provided in the question, which will help you to jump to an answer straight away. So you should not make a mistake here. So can we learn about all those urine odors and disorders? Yeah, so the first one is, what did I tell you? Yes, Dokat, it's important. Very good. Yes. So what is the first one I told you? The first one which I told you is mousy odor. Mousy odor is a feature of what? Phenylketonuria. And if you're asking me, how do I remember this? You can remember this using this image. So what is that you see in the image? Don't you see that a mouse and keyboard? Yeah, mouse and keyboard go hand in hand. What will you use this to remember? Mousy odor is a feature of ketonuria. Yeah, mousy odor is a feature of ketonuria. Okay, so that's about the first thing. The second one, the second odor also you all know, fruity odor. What is fruity odor? Fruity odor is a feature of diabetic ketoacidosis or any ketoacidosis for that matter. Yeah, fruity odor is a feature of diabetic ketoacidosis, or in other words, any ketoacidosis. Okay. And then cabbage odor. The third one is, because you're done with the fruit, let's think about a vegetable, cabbage odor. Cabbage odor is a feature of type 1 tyrosinemia. Okay, cabbage odor is a feature of type 1 tyrosinemia. How do we remember this? Use this image for your visual memory. What is that you see in this image? Do you see that cabbage is grown in tire? Yeah, tire has been repurposed to grow cabbage. So use this image to remember that cabbage odor is a feature of tyrosinemia. Do you understand this? Cabbage odor is a feature of type 1 tyrosinemia. And then boiled cabbage odor. The next one is boiled cabbage odor. So cabbage odor by itself is not that great, right? Now boiled cabbage odor is too much to handle. Yes or no? Boiled cabbage odor is too much to handle. Too much is hyper. Yeah, too much is hyper. So it's a feature of hypermethionemia. Boiled cabbage odor is a feature of hypermethionemia. The next one is also related to methionine. It is methionine malabsorption syndrome. So what is the next one? The next one is methionine malabsorption syndrome. It is otherwise called as Osthaus syndrome. Yeah, it is otherwise called as Osthaus syndrome because in this condition there is Osthaus odor. That is, what is Osthaus? Osthaus, this is how an Osthaus would look. It is used as a furnace to dry hops flour. Yeah, abroad in European countries, this is the Osthaus wherein they dry hops flour to add flavor to beer. So Osthaus syndrome is otherwise called as beer baby syndrome. It is otherwise called as beer baby syndrome because those children will smell of beer. And what is this methionine malabsorption? You understand this? Because of methionine malabsorption. And I want you all to remember this image. In this image, do you see blue skies and white cloud? Don't you see blue sky and white clouds? Yeah. So use this to remember that Osthaus syndrome, children present with white skin. Yeah, they present with white skin and blue eyes. Do you understand this? Osthaus syndrome will present with white skin and blue eyes. And what is this Osthaus syndrome due to? It is because of methionine malabsorption. Okay. And then the next one. The next one is, have you heard of swimming pool odor? Yeah, the next one is swimming pool odor is a feature of Homocystinuria. Swimming pool odor is a feature of Homocystinuria. Use this image. So in this image, do you see a hawk flying above the pool? Yeah, do you see a hawk flying above the pool? So Homocystinuria is a feature of Homocystinuria is characterized by swimming pool odor. Okay, have you memorized it? Yeah. The next one is sweaty feet odor. The next one is sweaty feet odor, which is a feature of isovaleric acidemia. Sweaty feet odor is a feature of isovaleric acidemia. If you're asking me how do I remember this? Yeah, have this image. So in this image, do you see that the feet is on the ice? Yeah, feet are on the ice. So sweaty feet odor is a feature of isovaleric acidemia. Do you understand this? Sweaty feet odor is a feature of isovaleric acidemia. And then as many of you have been answering it, burnt sugar odor. Right? Burnt sugar odor is a feature of maple syrup urine disease. And the last one, I think somebody answered it, Dr. Sad official. So he was saying something called as fishy odor. So in which condition do you see fishy odor? Fishy odor is caused by the defect, a condition called as trimethylamminuria. Fishy odor is caused by a condition called as trimethylamminuria. So these are the urine odors which will help you in making a diagnosis of a disorder. Yeah, can we repeat this? Will you repeat it along with me? Yeah. So what is the first odor that I told you about? The first one is mousy odor. Mouse and keyboard go hand in hand. So mousy odor is a feature of phenylketonuria. Fruity odor, yes, tomcat urine disease. Very good. So tomcat urine disease is a feature of multiple carboxylase deficiency. It's a feature of multiple carboxylase deficiency. How do we remember it? Cat. Cat has got CA and it is caused by what? Carboxylase deficiency, multiple carboxylase deficiency. Okay, so fruity odor is a feature of diabetic ketoacidosis. Good, Aishwarya. Thanks for reminding Aishwarya and Yogesh Kumar about that condition. And then after fruit, remember a vegetable. Which vegetable is it? Cabbage. Cabbage odor, remember the image which I showed you. Tire is repurposed to grow cabbage. So cabbage odor is a feature of type 1 tyrosinemia. After cabbage, it is boiled cabbage odor, which is too much to handle. What did I tell you? What is too much? Too much is hypermethionemia. After hypermethionemia, methionine malabsorption syndrome, that is characterized by beer odor. So it is also called as Osthaus syndrome. Okay, it is Osthaus syndrome. And then it is swimming pool odor, which is a feature of, just remember, a hawk flying above the swimming pool. So swimming pool odor is a feature of Homocystinuria. And then sweaty feet odor, just imagine or visualize the image which I showed you, wherein feet are kept on the ice. So sweaty feet odor is a feature of isovaleric acidemia. And then rotten fish odor, that is a feature of trimethylamminuria. Tomcat urine disease is caused by multiple carboxylase deficiency. Okay, so that's all about urine odor and diagnosis. So what is the right answer here? The right answer here is mousy odor, untreated phenylketonuria. Optically inactive amino acid is, which is the optically inactive amino acid? I will end this session by tell you like 8 to 9 facts related to amino acids. These 8 to 9 facts are being repeatedly asked. Okay, so the optically inactive amino acid is, very good, Lakshmi has answered it as tyrosine. Many of you have answered it as glycine. So what is the right answer? The optically inactive amino acid is glycine. Okay, because glycine is the simplest amino acid. In glycine, the R group is just a H. Okay, any amino acid will have a carboxyl group. As the name indicates, amino acid will have an amino group and an acid group. Yeah, amino acids will always have an amino group and an acid group. And the R group in glycine is just a H. In this case, do you see any asymmetric carbon atom in glycine? Do you see any asymmetric? What is an asymmetric carbon atom? It's a carbon atom in which all the 4 valencies are satisfied by different groups. Here 2 of its valencies are satisfied by the same hydrogen. So there is no asymmetric carbon atom. Without an asymmetric carbon atom, there can be no optical activity. So what are the facts that we are going to learn as far as amino acids are concerned? The first fact is, which is the simplest amino acid? Give me the answer quick. The simplest amino acid is glycine. Aishwarya has answered it as the most abundant amino acid. I would like to complete the statement saying it is the most abundant amino acid of collagen. Do you understand this? Glycine is the most abundant amino acid of collagen because collagen is made up of repetitive units of glycine XY. Don't you know that? Collagen is made up of repetitive units of glycine XY. So glycine is the most abundant amino acid of collagen. So the simplest amino acid is glycine, and the amino acid which is optically inactive is also glycine. Yeah, the optically inactive amino acid is also glycine. Okay, and the other fact about glycine which has been repeatedly asked in FMG is, what are the 2 amino acids which disrupt alpha helix? What are the 2 amino acids which disrupt alpha helix? It is again proline and glycine. Yeah, the 2 amino acids which disrupt alpha helix will be proline and glycine. Okay, and then what are the, which is the amino acid? Because we are discussing about proline and glycine, which is the amino acid? Amino acid is proline. Okay, and what are the aromatic amino acids? What are the aromatic amino acids? The 3 aromatic amino acids are phenylalanine, tyrosine and tryptophan. Okay, the 3 aromatic amino acids are phenylalanine, tyrosine and tryptophan. Now, what are the sulfur containing amino acids? I told you, right? When we started the session, I told you what are the sulfur containing amino acids. It is cysteine and methionine. Okay. What are the hydroxyl group containing amino acids? There are 3 hydroxyl group containing amino acids: serine, threonine and tyrosine. Yeah, the 3 hydroxyl group containing amino acids are serine, threonine and tyrosine. And today in the Telegram group, somebody was asking me which amino acid cannot get phosphorylated. Only hydroxyl group containing amino acids can be phosphorylated. So what are the 3 amino acids which can undergo phosphorylation? Serine, threonine and tyrosine can undergo phosphorylation. So can you repeat all the facts that I've told you so far? The simplest amino acid is glycine. Optically inactive amino acid is glycine. There are 2 amino acids which disrupt alpha helix. One is proline, the other one is glycine. The amino acid is proline. What are the 3 aromatic amino acids? Phenylalanine, tyrosine and tryptophan. Sulfur containing amino acids are cysteine and methionine. Hydroxyl group containing amino acids are serine, threonine and tyrosine. Okay. Now I want to tell you about 2 mnemonics. Yeah, I want to tell you about 2 mnemonics. One is HIP. Yeah, the other one is TIA, hip and TIA. Have you heard of transient ischemic attack? Yeah, transient ischemic attack, TIA. So what does HIP stand for here? HIP stands for histidine. H stands for histidine. I stands for imidazole ring. Yeah, I stands for imidazole ring. P stands for Pauli's test. P stands for Pauli's test. So what is HIP? HIP means histidine has got imidazole ring. Yeah, histidine has got an imidazole ring and it answers Pauli's test. Okay. And the next one is TIA. It is not indole ring. It is imidazole ring. Okay. The next one is TIA. T stands for tryptophan. T stands for tryptophan. Tryptophan has got an indole ring. Tryptophan has got an indole ring and it answers aldehyde test. Tryptophan has got an indole ring and it answers aldehyde test. Okay. And the last fact that I want you to know is histidine. Histidine is a physiological buffer. Do you understand this? Histidine acts as a physiological buffer because pK of histidine is 6, which is close to physiological pH of 7.4. Yeah, pK of histidine is 6, which is close to physiological pH of 7.4. That is why histidine can act as a physiological buffer. So are you clear about all these facts? Yeah. I think somebody was asking me about branch chain amino acids. Branch chain amino acids include leucine, isoleucine and valine. Yeah, valine, leucine, isoleucine are the 3 branch chain amino acids. Yeah, histidine and arginine are semi-essential. I will be telling about essential, semi-essential amino acids, both histidine and arginine, Aishwarya. Yeah, both histidine and arginine are semi-essential, about which we will be discussing when we discuss metabolism of amino acids. Okay. Yeah. So which is the optically inactive amino acid? Tell me the right answer quickly. The optically inactive amino acid is glycine. Which of the following amino acids disrupts alpha helix? Can you tell me the answer? Which of the following amino acids disrupts alpha helix? There are 2 answers here. One is proline, the other one is glycine. Given a choice, go for proline. Yeah, given a choice, go for proline. So what is the right answer here? The right answer here is D. Proline disrupts alpha helix. If you want to know why, yeah, if you know why, you will not forget it. Did I tell you proline is an amino acid? I said proline is an amino acid. What is an amino acid and what is an amino acid? Amino acid will have NH2 group as the functional group, whereas amino acids have only NH as the functional group. So proline has got 1 hydrogen lesser. Will you agree with me? Yeah, proline has got 1 hydrogen lesser. And what is the linkage which stabilizes alpha helix? Alpha helix is stabilized by hydrogen bonding. So can proline take part in hydrogen bonding? Can proline take part in hydrogen bonding? No. So proline disrupts alpha helix. Got it? Yeah. So the remaining we'll discuss in the next class. 1 cycle per class. Okay, I will try to do that from the next session. Okay. So the remaining we'll discuss in the next class. See you all. I will post the schedule in the Telegram group. Thank you. Good night.